Sugar, not salt, might actually be the root cause of your hypertension, and I can explain why. The strategies that are used for cholesterol are not nuanced enough. They're checking a basic cholesterol panel which has these few lab values, and if this is too high, you prescribe this medication. So for instance, you're looking at LDL cholesterol, and that's supposed to be the bad cholesterol. It's not going deep enough if you're just focusing on LDL in general, because there's different subtypes of LDL. One is dangerous, one is not. So then you ask the question, is the cholesterol, the statin drug, is it lowering the right type of cholesterol? And the answer is actually not. It's lowering the neutral type of cholesterol and leaving mostly the bad cholesterol behind. The current strategies for addressing cholesterol are, first of all, focused on the wrong thing. They are saying that you have cholesterol because you ate fat, when it's actually because you ate sugar. And then secondly, the strategies of prescribing the medications aren't as effective in reducing risk as we once thought, and they actually might be causing harm. To tie it back to like more of a in-depth approach, there needs to be more information looked at rather than just those basic labs. And that goes along with this approach of looking at lifestyle, not just prescribing a medication based on lab values, but looking at all the things that are creating the situation that caused you to need the medication in the first place. And correcting your lab values by way of reversing what caused them to be off in the first place. You don't just get high cholesterol out of the blue. You get it by repeatedly doing something. What is that something? That's what this approach seeks to find out. And in most cases, it's not what you were told, which was probably consuming too much dietary fat. Dietary fat does not go straight through and become blood fat. It goes through the liver and is used to repair things, whereas sugar goes to the liver and gets shipped out in the bloodstream in the form of fat and cholesterol, and that's what becomes the dangerous fat and cholesterol. But the strategies and the knowledge that is given by conventional medicine doctors is not that. We're telling you that, oh, it's because you ate too many eggs. That's why you have high cholesterol, or you ate too much butter. Not the case. And then you end up avoiding those foods and missing out on the nutritional value and the nutrients that those foods give. And then you get a nutrient deficiency because your doctor told you you eat too much of these things in the first place. And then not only do you not improve your cholesterol, but now you developed a different problem. So that's what happens when you take too surface level of an approach, so to speak. Or if you go with this approach that's aimed at fixing numbers, but on not a deep enough understanding of what caused the numbers to be off, that's the danger of like doing things that way.